Good morning. Today we'll be talking about men's health. And with me, I have two very interesting people. Good morning, Dr. Talabi. It's a pleasure to have you again with us once more.
Good morning,
And
Dr.
Dr.
P.
Jimoh as well. It's lovely to have you here with us.
Good morning, ma. Good
It's
morning, everyone.
very important
Good
two
morning.
men on the program because we're talking about men's health specifically. So if I can start with you, Dr. Talabi, why is men's health important? Why do we need to talk about it?
So if we would go back to statistics and see really what has happened a few decades or few years, you would know that men are less likely than women to have a routine medical checkup. They just don't think they need it. I think it's that edge that we are strong enough, we are good enough. So far as we keep on moving, we're fine. There's a survey by the American Academy of Family Physicians that found that 55% of men have not seen a clinician for a routine checkup in the previous year. Around 40% of them at least have a chronic condition. It means that even when they have a diagnosis of a disease, of a chronic condition, they still won't visit the doctor. They now says nearly 1/5 of men ages 55 and above have not been screened for colon cancer. And what they say is that unless they have pain, unless they're sick, they are not seeing a doctor. So it shows the way the men think and what we have in line for us. It also says that having a brother with heart problem before the age of 50 could mean that you are at risk as well. Of course, we know being black alone is a risk. Risk for high blood pressure, risk for diabetes, risk for prostate cancer, right? Also, we know that eating healthy reduces the risk of chronic and life-threatening conditions like heart disease, diabetes, and some of the common cancers. But if you tell them to eat healthy, they say they're not goats because they don't like eating vegetables, don't like eating fruits. No, how do you expect me to eat that? Doc, what do you mean by that? So those are things that we confront on a daily basis with our men, and it's something that we need to take seriously. And there's something that men don't know, and I think it just pertains to women alone. So women have menopause, right?
Yes.
But men also have menopause. It's called andropause, right? It means that as soon as they clock the age of 40, the testosterone is going to reduce by 1 to 2% per year. So it means that as a woman's own is reducing, theirs is also reducing. I actually say that a man has ovaries by the time he's 60, and a woman has testicles by the time she's 60. Yeah. It's just that you just invert it, right? You feel like a woman, when she's above the age of 60, she's quite strong and she's always very on the tail, but the man is always subtle by the time he reaches the age of 60, 65, right? And those are the other things. We say that about 10 to 17% of men will develop depression.
Really?
We're talking about depression. Mm-hmm. Yet at some point in their lives, when they do, and it can be deadly. It means that if a woman develops depression, she can be treated and she can be fine. But once a man develops depression, it's easy for him to commit suicide. It's easy for him to die from it, right? And just to sum it up, roughly 2/3 of adult men are overweight or obese. So it tells you how we're doing it, right?
This program is so long
we also need to talk about the alcohol. Yes, we also need to talk about the alcohol intake. Yeah. A standard drink means 12 ounces of glass of beer, 5 ounces of glass of wine, and 1.5 ounces of shot of hard liquor. The problem about men is that when they start, they don't know when to stop. So if you come to me and say, Doc, can I drink? I will say, it's not that I don't want you to drink, it's that you just don't know when to stop. And some will tell you, but I'm a social drinker. I drink once, on the weekend. Then I ask them, how many bottles do you drink? Like 4 or 5 times 6. He was like, okay. It's like saying that you take a bottle a day, right? He's like, what do you mean by that? I said, if you take 6, that means you look at it, 7 days make a week. You take 1 every day. You're taking 7 bottles. We're taking 6 at a time. And Doc, I didn't think about it that way. So that's what we face on a daily basis with our men.
Wow. So where do we start? What do we want to tell them? Because, there are just so many different issues that we need to deal with here. Let's the issue of just even, how do we get them to do that? Because these things are simple. These things, we have men listening to this program. We do. But are they actually acting on the things they hear? I don't know. What do you normally say to them? See them in the clinic?
I think so let's have it in mind that most men that come to the clinic is because they are ill, not because they want a preventive checkup, not that they want to do an annual assessment. Very few would come and say, I want to check up myself and see how I'm doing. Most of them will be proud to say, Doc, I have not visited a doctor in the last 20, 30 years, and they feel it's good. I said, "Wow, that's your biggest mistake." So what do you mean by that? I said, take your car, for instance. Imagine if you don't service it in 20 years. Or Doc, you have a point there. So I think the most important thing is we need to create more awareness to the men, right? This sensation strong, we don't, nothing can hit us, we are good. We need to stop it because very soon, have you noticed, or everybody understands that we have more widows than widowers, right?
Definitely.
So it means that a man automatically died before, a married man died before his wife by all standards.
Yeah.
And you'll find out that it's the woman that she's done cervical cancer screening, she's done a mammogram, she's done so many things, while the man still at 60 has not even checked his prostate out. So you ask, what's going on? And as time is going, you find out that even these cancers are now appearing much
Younger.
faster, much quicker, and in younger ages than we used to. So we used
Yeah.
to think it was 50. But in black men, we're going 40 and above, sometimes 45, because that's the age. And we need to have that awareness. Then,
And that's
there
prostate.
needs to be
We
there needs to
also
be a
have an
screening
issue with
program led by the government.
we also have an issue with the colon cancer. It's like people are just not
Yes,
even, they don't even think about it. Say people occasionally talk about it, but they don't even, think about it. It's commoner in men, isn't it?
yeah. So you also will look at, for instance, I think it was an actor that came into 2 or 3 days ago, Van de Beek, skinny guy, well built. I don't think he had colon cancer. I said, listen, I have colon cancer. And it's because people think that just because you're not fat, you're exercising every day, means you can't get it. There's a possibility that your risk factors reduce to a level. Doesn't mean you shouldn't be screened. Doesn't mean you shouldn't have your test done. Doesn't mean you shouldn't have the FITs. Doesn't mean you shouldn't have a colonoscopy done. Right? As soon as I always tell my patients that are married, I said, as soon as your husband clocks 45, give him a voucher. What do you mean? Give me a health voucher. Let him go do his screen. That's his birthday present. And that comes with the health assessment, comes with colonoscopies, comes with everything that is necessary for us to see the status as we speak at the age of 45.
And after 45, how often should they do it? Because some people say, okay, I had a check at 45. Now they're 60. They had a check, they're still relying on it.
So we usually advocate for annual checks, but for instance, colonoscopies, depending on where you look at it, you can do every 5 years, every 10 years. But for annual checks, the blood levels and check how they're doing. So if there's no diagnosis and you are apparently healthy, by the age of 45, then you do an annual check every year. But if you have a diagnosis of high blood pressure, of diabetes, of high cholesterol levels, then you see every 6 months.
Some people will say, that doctor, them, they just want to take our money. They just want to collect our money. Why should I come to you if I'm well every year?
I will tell you one thing. I will take your money more when you're very, very ill because you spend more time with me.
Wow.
So, yeah.
I think we have these very frank conversations. Because, I don't know. It's like when you're young, think they're invincible. But for some reason, men seem to think they're invincible forever. Even though they around friends are dropping. They
Yeah.
know.
I
So how,
think
what, because I don't know what wake up call you need to give people.
I think that there are different things that we can do apart from the valuable and reliable health education that we are doing using your Doctors on Air, for instance, that's promoting health, because this is purely health promotion. And it's also for them, it's also creating awareness for them to understand that they need to see the doctor. Also, we need to also make sure that the government and the communities are in tune with this. right? So if you look at it, go for health checkups, right? The majority of people that are coming for health checkups, so for instance, when we do the outreaches for churches or for mosques and things like that, have you noticed that it's mostly women?
Yes, it is.
It's mostly women. It's very hard that you find it men are coming. If they're men, maybe very old, the 67, the 70s, the 80s are the ones
And they're
coming,
not
the
feeling
men
well.
that are, and they're not feeling well already. But when you look at it, the outreach, and I cease to be corrected, the ones I have done mostly are women. It tells us that the men still don't know or they don't want to know. And this is not a Nigerian problem. This is a universal problem.
Wow. I mean, it's just, the whole premise on which we act is that we talk, people listen, and change their behavior. But when you talk and people know and they're aware of it, I mean, I don't know. Is there any wives, mothers, sisters can do?
Well, I think the way, and I said one of the things I usually advocate is for the vouchers when they have their birthdays, but also a way a woman can say thank you to her husband is by guaranteeing a doctor's visit. And it's not that she wants him to be ill, it's more or less for him to understand that she cares and that she wants him to be well. I believe that we still need our mothers and our wives and our daughters to understand that if we prevent it now, it's better than cure. Because the truth of the matter is that when the man is now ill, everybody stops.
Mm.
Everything stops. The
Maybe.
mother doesn't concentrate on the kids anymore. She has to be with her husband. There's no money, there's nobody making money for the family anymore. The kids are not being taken care of because the kids go to school and come back and the nannies are not taking care of the kids. There's so much disruption in the family, right? It's just a lot of disruption. And so we need to make sure that we each unit is in tune with what they have. So, for instance, when we have a man that has high blood pressure and doesn't take his medication, then he wakes up one morning and has a face that is deviated to one side and is asking God why. I'm like, how do you ask God why? You had your medication to take. If you had popped it up, you won't be like that. It's as simple as that, And it's just re-emphasizing with our patients. So I usually tell them that listen, don't run away from consult. Come back. Let's speak to you. Let's hear what you have. Any problem that we need to tackle, we're tackling up as a team, as a unit, and we'll face it.
Okay. Thank you, Dr. Jimoh, for coming on the program. It's important that we have you here with us. There are a number of cancers that affect men. We always talk about cancer, but one that is really not talked about enough is testicular cancer. Can you talk a bit about testicular cancer before we go on to
it's where it's not as common as prostate cancer, and then it's a treatable medical conditions that most of them respond very well to treatment when they come down with it. Although in this part of the world, we see more of them late. Once they come early, it's a treatable conditions.
So
It's
how can
usually
we
come
pick it up early? What are the kinds of things people should do to pick it up?
That is the point. The symptoms, include feeling of maybe heaviness in the scrotum, and then you don't stay at home. Like heaviness in the scrotum, that's the most important thing that they see, or painful scrotum, or swelling scrotum. So these are the symptoms that once an individual gets that symptom, you need to just come to the hospital. Don't just go and buy paracetamol and say it's going to take care of it. So those are the things, and it will pick it early, and then you can be able to take care of the disease.
Thank you. I think it's important that we actually know it's treatable, and also people need to know, both men and their women, to be aware that this is an area that we have to look out for, particularly in men. We're just rushing things at the moment, so I just want to go into prostate cancer because prostate cancer is a huge issue in Nigeria, in Black men. So can you just talk a bit about that as well? Because as Dr. Talabi said, people are not going to themselves enough. So tell us
Thank you very much, ma'am. Yeah, as we all know that prostate cancer is a complex disease that affects millions of men globally. And it's a slow-growing tumor. In most cases, it could be asymptomatic. The more reason why people need to go for screening we need to talk about men's health like we are doing now. Women talk about breast cancer. Men don't talk about prostate cancer. And like I said, most symptoms are asymptomatic. Unless if the disease has spread, people will not come to the hospital. So the screening, early screening is better. 40 years and above, and then 1 yearly with digital rectal examination. So family history can come earlier than that to do the screening.
What do you mean by family history? For those who are listening, what do you mean by family history?
People that have maybe there's a history of cancer in the family. Father has a prostate cancer. So all the children that are male, they are at risk. So they need to come earlier for the screening so they can be picked. Okay. It's more common in Africa, like Dr. Talabi said. More common in Africa, African Americans, even more than European Americans, it's more common.
Okay. So it's more common in blacks. That's clear.
Yes.
And you must start screening as a black man from the age of 40.
40.
Okay, yes. So that's clear. I think that's where everybody can hear this. All the mothers, all the sisters, all the wives. I think you can hear this quite clearly. From the age of 40, please let us start for prostate cancer because it's treatable. Now, but if there's any family history, they must start. Now, what are other risk factors?
Thank you very much. The number one on the list is the age. Increasing age is a risk factor to prostate cancer. And then it's more common above 50 years. So that is why when you are seeing prostate cancer at less than 50 years, it's going to be an aggressive disease. Right, this is number one, age increase. And then another one is the race. Ethnicity, we talk about blacks. There's more in blacks than the Caucasians. These are another risk factor is the family history. I've said it. A father has prostate cancer, the children who are male are at risk of prostate cancer. So another thing is lifestyle. We talk about people don't do exercise, lack of activities, lack of exercise, no sedentary lifestyle, no inability to eat good food, we eat junks here and there, smokes, processed and all that. They are implicated in prostate cancer. And likewise, the genetic susceptibility is also one of the things that two major factors. Modifiable or non-modifiable. The one that is not modifiable, there's nothing you can do. But when the one that is modifiable by diet and environment, then you can do that to help. So these are the things that can contribute to development of prostate cancer.
You should say that because what is trending, particularly now in Nigeria, is this statement that you have to have developed prostate. And this is something that is very advocate. Men abandon their wives and go out and have sex with other women. They are advocating manner of infidelity, disregarding things like HIV, hepatitis that you can pick up from because
okay, so yes, there was more getting information throughout a long period of time. I think the study started in 1986 and finished in the year 2000, and that's more than 44 years ago. And the study was mostly done in young white male. And it had reduced the risk of having prostate cancer by 21%. That just being white alone. So this study pulled it up and said, this is what we're going to use, and this is what worked. In Australia, or also it was white. It wasn't really black people. That they found that also if you ejaculated, not if you had sex. So when you ejaculation, it means that masturbation, night emissions, that's wet dreams. So this men will just give them the count of what transpired during the week, and they'll take into consideration, and they'll say, okay, well, It means as if this guy is at least is releasing he's at least 21 times, more than 3 or 4 times a week. Right. But as I say, it wasn't in Black people. It was mostly white. So the question is, do we take it as a strong evidence? I don't think so. I think I'm more over it has been so many years ago. It's something that it gives you an avenue for more research. So if we're going to research it now in Black people and see whether it actually would help, that's another story for another day.
Dr. Jimoh, your thoughts?
Yeah, thank you very much. I want to agree with him because once there's no evidence base, it's difficult to accept that. We have not done any study that showed that. And among the stated evidence-based risk factor, it's not there. So it's difficult to just accept that. There's another thing I want to bring up here, and we've been seeing it, we ruminated about it in conference. Even the standard value for PSA that we use, which is 0 to 4 nanogram per ml, this is done among the Caucasians. If you go into our history here, you discover that Black men have more in number, the PSA is more increased than the Caucasians. But we have not done any study to have our own value. So it's dicey to just accept that factor that, ejaculation 21 times is a risk factor. I don't want to support that.
Yeah, I think the reason why I actually bring it up is that it's causing a lot of distress. I mean, we don't have much time left in this program, but there's a lot of distress, and it's causing people to go out to have infidelity. It also causes a lot of pressure. They were not even in the story. I don't know. We need to just have a few last words for our listeners, because unfortunately time is up. I can't really take this thing any further. So I don't know, Dr. Jimoh, if you have any last words for our listeners.
Yeah, thank you very much. Well, I would just because let's continue to listen. This health is very important, like we discussed the women's health too, and people should go for screening. For prostate cancer, we talk about PSA. For colorectal, we talk about colonoscopy, which is very important, and our lifestyle changes is very key. Exercise we don't do. Fruit and vegetables we don't eat. Water we don't take. We need to do all those things. It's very important for our health.
It's addressing the lot of anxiety that a lot of women and men are having for this 21 issue. Any last words?
I believe that just have sexual intercourse with your wife the best way you feel, right? There are some things that are preventable, and there's some different avenues we can use to prevent things. But enjoy your wife, enjoy yourselves. That's what I have to tell them. And we tell them 21 or more.
Thank you very much.
Thank you.
Thank you for watching. Please like, share, and subscribe for new video updates.